Hello doctors, myself Dr. Tejaswini Samir Bhale. I am an Ayurveda physician and working in Pune for last 15 years in my private clinic at Prakruti Ayurved Panchakarma. And I am also associated with Atreya Innovations Private Limited for the development of Nadi Taringidi. So today we are going to discuss about the fundamentals of Ayurveda, which we already did in our graduate and postgraduate level. But in our today's practice or in our clinical practice, we need to revise all those things again. So today we are going to discuss from the basics of Ayurveda, which we can say which will start from the Tridosha. So we know already that Ayurveda is a holistic medicine. It is not only related with the cure of the disease, but also for the well-being of the mind and body. So in Ayurveda we consider body, mind and soul, that all we know. But when we are going to diagnose any disease or treat any disease, we should consider that we have to cure not only the body, not only the disease, but also the main cause, and which is related with mind also. So the very first fundamental, that is we can say our Nyaya, is the Prakriti and Purush Nyaya, and which we know that everything which is present in the universe, as we say as a Panchamahabhuta, they are all present in our body too. So our Prakriti and Purush Nyaya is a very important thing that we have to consider. Then only we can use each and everything available in the universe, not only the medicines, but also our diet, our food, as a medicine to treat our patients. So we know the Panchamahabhuta and their relations with Tridosha. So as the Panchamahabhuta, we know that it is a Prithvi, Aap, Tej, Vayu and Akash. So for the Kapha, the Prithvi and Aap Mahabhuta are involved. For the Pitta, that is the fire and air, that is the Agni and Vayu Mahabhuta are involved. And in the Vata, the Akash and Vayu Mahabhuta is there. So we have to consider all these Pancha Mahabhuta in our practice, and we have to correlate it with the Tridosha, that is Vata, Pitta, Kapha. And basically the first that comes is the diagnosis, that is Nidana. So we have to consider this Prakriti and Purush Nyaya. So now what are the Tridosha that we know very well, that is Vata, Pitta and Kapha. So these are the basic humors which are present in our body and mind and in universe too. So if they are in a harmony, in a balanced state, then we can say we are in healthy state, the person is healthy. But the imbalance of this dosha, that is Kshaya and Vruddhi, they cause the disease in our body. Mainly the Vruddhi Avastha gives the symptoms, and we call it, and the group of those symptoms we name it as some Vyadhi or disease. What is Prakriti? Very important thing before going towards the Vikruti, we should know about the Prakriti. Now everyone we know that the Prakriti forms at the time of conception. That means it is before the birth of a person. So which comes from the father and mother, and at the time of conception, according to their diet and lifestyle, the baby or the new fetus gets their Prakriti. So always we have to consider about the healthy state, that is the Prakriti of the patient, when we are going to do the Nidan or diagnosis about any Vikruti and to give the treatment. So we know the types of Prakriti also, that Ekadosha, Samadosha and the combination of the dosha. So now in this lifestyle, the Ekadosha and Samadosha Prakriti is very rare. Means as we are having very vitiated lifestyle, our diet and all the things. So the Ekadosha and Samadosha Prakriti is very rare. So the combination of the Prakriti, maybe Vata Pitta, Vata Kapha, Kapha Pitta, like Prakriti we can find out, and which is very important to know to give the treatment part. Next to the dosha that we know is the Dushyam. So what is the Dushyam? When the vitiated dosha, or the one who gets vitiated by the dosha, we call it as Dushyam. So in that one we have the Dhatu and Mala and Manas. We know the 7 Dhatus, that is Sapta Dhatus: Rasa, Rakta, Mams, Med, Asti, Majja and Shukra. So when we are talking about the 3 dosha, so how these 3 dosha are vitiating this Sapta Dhatu, that we have to consider when we are having any patient in our clinic. and they are showing some symptoms. So according to the dosha, according to the dhatu, which dhatu is vitiated and which dosha is vitiating it. So now we are having the mala also, that we are having three mala, that is mala, mutra and sweda. We have to consider that too. Mala is not the part which we have to just throw out from the body, but they are removing the toxins, the armor, and which is the main metabolism of our body. That the feces, urine and the sweda, that is sweating, is important, through which we can do the detoxification also. And the very important part is the mind. So we have to consider about the manas, the guna, that is sattva, and the dosha, that is raja and tama of the mind. Now next to that we have to consider about the srotasa, that is our systems. Now we are having the three dosha, the saptadhatu, three mala. So what is the srotasa? Srotasa is the system or the channels through which this toxin, the dosha, the toxins, the dhatus moves. So this srotasa should be very clean and the passage should be clear. Then only the energy could flow through it. So our system is having the dosha which is related with the Annava Srotas, Udakva Srotas, Pranava Srotas, 7 Srotasa of each dhatu, 3 Srotasa of 3 mala and the Manoha Srotas. Also according to the some acharyas, the Artava Srotas and Stanyava Srotas is also included in the female, which is the extra one that we have to consider for the lady patients. Now when we are going to do Nidana, what is our main fundamental of which is our main basic is the Tri Sutri of Ayurveda. That is the Hetu Linga Aushadha Jnanam Swasthatura Parayanam. That means when we have to consider any person as a swastha or atura, that means the healthy one or the diseased one, we have to consider the hetu, that is the causes of the disease, linga, that means the symptoms, and then the aushadha, that means the treatment we have to give to him. So what are the types of nidana, that is diagnosis? Now when any person is coming to our clinic, how the person is coming to us, how he is walking, how he is talking, the style of how they are sitting, in that way we start our observations. So we call it as the Trivida Pariksha, that is Darshana, Sparshana and Prashnaihi, which is the very basic thing that we have to do. The first one is the Darshana, means we are observing the patient, how they are behaving, how they are talking, all those things. If any deformity is related with joints, so we can observe that patient couldn't move properly or any stiffness is there. That is our Darshan Pariksha. The second one is the Sparshan Pariksha. That means we are touching the patient, or now we can auscult the patient's chest. So by ausculting we are doing the Sparshan Pariksha. Now also in Darshan Pariksha, in today's we are having all the technology is there. So we are having the sonography, we are having the X-ray. So that is also comes under Darshan Pariksha. Now by Sparshan we are touching, we are examining per abdomen examination is there. If any joint is impaired, we are trying to move it, we are going to touch it where it is inflamed, whether they are having hot, the temperature we are checking is the Sparshan Pariksha. And the next one comes is the Sprashnaihi. That means we are asking person about their past history, their family history, and how the disease had formed today, about all the information about that patient. That comes under the Prashnaihi. So now to go in the deeper way, that after Trivida Pariksha, the Acharya has suggested about the Ashtavid Pariksha. And in that one we are having the Nadi, Mala, Mutra, Jivva, Shabda, Sparsha, Druk and Akruti. So what are they? That we know as Ayurveda doctor, we know all these things. That means it is the first is the Nadi Pariksha, second one is the stool examination, urine examination, tongue examination, ear, skin, eyes and the physique of the patient. So this is the Ashtavid Pariksha we are going to do to get more and more knowledge about the disease. And after that, the Charaka has discussed about the Dashavida Pariksha. So there are the 10 parts or 10 types of examination, in which the very important is the Prakruti, then Vikruti, Sara, Sammanana, praman, satmya, sattva, ahara, vyayam and vaya. So we have to consider all these things too in our diagnosis procedure or when we are taking the case study of any patient. Now we know the dosha, we know dhatus, we know dravya, that means the medicines or the diet we are going to use. But how these medicines works, how this dosha works, everything which are going to work means they are having some properties. So our Ayurveda science that is described about the samanya guna, that is the properties which are present in the universe, in each and every object in our body, dosha also, diet also, medicines also, and we are going to consider this guna when we are going to do any diagnosis and giving the treatment. So what are these guna? We call it as a samanya guna or the sharir guna, which are described in a form of 10 pairs, one and opposite to that is the second guna. So there are 20 guna we are having, which are the guru, laghu, shita, ushna, snigdha, ruksha, manda, tikshna, drava, sandra, pichila, vishada, mrudu and kathin, shlakshna and khara, sthira and sara, sthula and sukshma. And all these properties are present in each and every organ, our system, that is Srotasa, and also in the dosha. In the same way, all these some of the properties we can observe in our Nadi Pariksha also. And in about this Nadi Pariksha, in our Nadi Tarangini report card, we are giving this guna in our report so that you can easily diagnose which dosha is or the which guna is having shaya and vruddhi, and according to that you can go towards the dosha and can give the treatment. The next nyaya or the siddhanta is the shat padartha, in which we are having the samanya, vishesh, dravya, guna, karma and samavaya, in which the samanya is the similarity, that means the similar properties when comes together enhances the action. Vishesha is the opposite, means the opposite properties when opposite properties or the gunas to the vitiated dosha when comes together, it cures the disease. The second one, the third one is the dravya. Dravya means any medicine, herb, diet, food, which is when similar to the dosha or opposite to the dosha, but how it works is according to the guna. So the dravyam gunena karma kurute, that means that every dravya is having some peculiar properties with which only they can do any action. So the karma, that means the any chikitsa which we are going to do is as per the guna of that dravya. And the samavaya means the dravya and guna always lives together. When they are apart, there will be no action by any dravya. Now as we have done our nidana, the diagnosis, now we know how the samprapti has happened. Now we know the groups of symptoms and we gave it as some vyadhi nama or any disease. Now we are going to do the chikitsa. The chikitsa will be, as we know, dosha or the guna viparita. As the dosha vitiated, we are going to give the treatment opposite guna. So what is this chikitsa? Yabihi kriyabihi jayante sharire dhatavaha sama. The treatment or the any action which we are going to do will make the dosha in balanced state, samaha, in the sama state. Sa chikitsa vikarana karmatat vishajam smrutam. So the doctor should know that this treatment or this action will make the dosha in a balanced state, and we call it as the chikitsa, which is the vyadhi parimokshana, that means opposite, which will cure the disease. So now we know the chikitsa part, that we are having the shaman chikitsa and shodhan chikitsa. In shaman we are having langhan, deepan, pachan, and also snehan, svedan, gruhan, and then shodhana as a panchakarma we do. And every dravya which we are going to use, which will act as a dosha prakopaka, means if we are using the same properties as the dosha vitiated, it will take it to the utklesha avastha, that means it will provoke it, and now we can easily take it out from the body. The second one is the shaman chikitsa, that means we are going to pacify the dosha. whatever the vitiated doshas are there, we are going to do the opposite guna chikitsa to pacify them. And the third one, which is very important, is the swastha karaka. That means to maintain the health of a healthy person or to regain the health of a diseased man. So the last chikitsa, we can say it as a punarbhav chikitsa or the rasayan chikitsa. Now what is the main aim of the Ayurveda? Now we know all the siddhanta. We are going to use it in our practice for our nidan and chikitsa, and we are going to advise the medicines, the diet, the lifestyle to them. So what is the main aim? That is the swasthasya swastha rakshanam aturasya vyadhi parimoksha. So if anyone is in a swastha state, that is healthy state, we are going to maintain that health, and if someone is diseased, we are going to do the vyadhi parimokshanam. That means we are going to treat them to get the to maintain or to regain their health again. So this is the main aim or the function of the Ayurveda, or the science itself. It tells about how to prevent the disease in order to promote the quality of the life and the longevity. Thank you.